Dr. Joppa, what things would you do if someone maybe were already prone to diabetes because of their family lifestyle or their, predisposition with their family? So there's that, but also it's such a huge thing. Like people who don't even have family members in the past who have had it, people are developing it like crazy. I think it's gone up like 3 times in the past 10, 15 years. Mm-hmm. So it's kind of like we're all
predisposed to it now because there's so much sugar everywhere. And
so can you give us some different things, some tips and tools we can do to help guide us into a balanced lifestyle that would help us to not maybe go into that?
Sure. I usually have my patients give me a list of all their foods that they're eating, and then I go through and I highlight, this is what you can continue to eat. And I focus on, keep eating all these vegetables, keep eating healthy beans, keep eating whole foods and whole grains, all the processed carbohydrates. I like to tell people I have a cult that I belong to, and we do not eat any baked goods. That's my cult.
So when you talk about processed foods, like what are some of the foods you
like
would put in
croissants, I would cut those out. Like if you're actually predisposed to diabetes, you want to give up that kind of processed flour. It spikes your blood sugar, it aggravates your liver, it depletes your adrenals, spleen, and pancreas. You want to give up those heavily processed carbohydrates. Honestly, I always tell people, try to avoid anything in a package. I know that sounds really extreme.
What about my bagel? Like if I'm running to get the train in the morning and I get a bagel and a coffee,
right.
Whole grains,
I don't
right?
do a bagel. Bagels are not whole grains.
Okay.
What you could do instead would be, a fresh vegetable frittata. I know you don't eat eggs, but some people that eat eggs, they could do vegetables and eggs together, and that would be protein and vegetables.
Okay.
Heavy on the vegetables, because vegetables have all those nutraceuticals that protect the internal organs. So what carbohydrates can you eat? You could do millet and quinoa. So on your plate, you want to have protein of some kind and some kind of a healthy carbohydrate that's a whole grain, and vegetables. So you could do like every single meal, you could do 1/3 vegetables, 1/3 carbohydrate like rice, millet, quinoa, and then 1/3 protein, hummus, beans, some kind of a chili, something like that.
So you're talking even breakfast then? So this is
Actually, yes. I know people love their sweet breakfasts, but I'd rather see someone eating vegetables and some kind of protein for breakfast rather than having like a big carbohydrate oatmeal-y cereal-y breakfast, because it kind of makes you crave sweets the rest of the day. You can experiment with it for yourself and see. Everybody is different.
Okay, so you're saying like starting with something sweet like that in the morning can actually keep you craving sugar throughout the day too?
Yes, I believe that it does. At least I've tested that on myself, and I've tested on some of my patients. If I take them off of that carbohydrate loading breakfast and put them on more vegetables and protein, they will have a more consistent day where they're able to stick to their plan and avoid sweets.
Okay, that's a great idea. So you're saying with each meal, keep it a good carb, like a good healthy carb, like a grain, a vegetable, and a protein at each meal.
Yes.
Okay, I can do that.
Yeah, and you'll feel full, you'll feel satisfied. And also another thing is to add healthy fats to the meal. Make sure, like if you're eating a whole food fat like an avocado, that has a lot of nutrition in it, very different from just sticking butter on it or sticking olive oil. You can also look for unrefined oils, like when you tilt the bottle upside down and you see particles floating through the glass, that's an unrefined oil. And that means that it has been less processed and it hasn't been stripped of its nutrition, and it will have more benefit for your body.
That's good to know, because that's always a confusion point for me with all the different oils. Like, do I get the virgin, extra virgin, this or that? So that's good to know on those. So we've talked a little bit about foods. What would you say about exercise? Like, what would kind of be the ideal exercise for people?
Exercise, you want to look at it like, how does a healthy animal exercise? Like, if I could be like my dogs and just run for 5 miles a day, wow, I'd be so healthy. So for myself, how can I add more movement into my life? Like, I see a lot of patients do great with those Fitbits where they track how many steps they take during a day. They may be very busy, but they're making choices to try to add steps in and add in walking. They're taking the stairs instead of the elevator. I think what's important to remember with exercise is even a little bit makes a huge difference. Even just deciding to walk out to your mailbox and pick up your mail and walk back to your house instead of driving out and getting it and driving to work. Even those little, any kind of movement that you can add, even if you just turn on the radio and dance for 15 minutes.
Yeah, and I've been doing something lately where I'm finding parking places further from the door when I'm out, so that makes me walk a little bit more too. Instead of trying to drive around for 5 minutes, trying to find a closer place, park further away and spend that 5 minutes walking instead.
That's great.
So I think
that's a great tip.
Yeah, I love that idea. It's just trying to get it, like we can't always take a half hour or an hour to exercise, but put it in where we can. Or I'm doing this too in the kitchen, like I squat down. If I drop something, I squat instead of bend over. So I'm getting my 10, 15 squats in every day.
So she's getting those big muscles in the thighs to move. That's great.
Yeah. You talked about kind of this overstimulation that we have in our culture, and that can also contribute to this excess of inflammation in our systems too. What are some kind of emotional ties that we have to developing a sickness like this also? Can you go into that?
Well, I feel like it is really beneficial for people to start really positive self-talking themselves and giving themselves rewards. Because if you think about that little part of yourself that really wants a sweet treat every now and again, just be really sweet to that part of yourself. Say, you know what? You did such a good job exercising all week. I'm going to go out and get you a special little berries, and I'm going to make you a little cashew cream with a little bit of maple syrup. So maybe you can make like a healthy sweet dessert that's like a low glycemic index and has some protein in it. Or you can say, I'm going to get that thing you've wanted on Amazon Prime for a couple of months if you do a whole week of exercise. So you give yourself a positive reward system and set yourself up to be successful with it. And when you meet your goal, give yourself some kind of a reward. And then you're giving yourself that sweetness and reassuring yourself instead of constantly harping on yourself and feeling bad about yourself. All those kinds of things on a subtle level deplete your chi and your energy over time.
Like kind of negative talk to ourselves. Okay. So you're kind of saying if we keep giving ourselves, like doing our positive affirmations for ourselves about self-love, self-care, coziness, things like that.
And set yourself up with an incentive system that works for you. What do you want? What can you reward yourself with that is healthy and helps you keep meeting your goals?
Okay. Like, for example, my daughter was doing this thing where she was like, if I read every day, she actually did this for herself. If I read every day, then on Friday I can reward myself with a movie on the iPad, like something kind of like that. Like you kind of do positive things for yourself all week, and then maybe on the weekend or even on a Tuesday, that's sort of an arbitrary, not very exciting day. You can choose a day.
Choose a day and make it special for yourself. Like myself, I struggle with keeping my house clean. I don't like housework. I find it really boring. But I'm like, Japa, if you can keep this house clean, I'm going to give you a reward. And I talk myself through it. And I go and get body work done. I get a massage done for myself if I stay on top of my housework.
I love that. Awesome.
Yeah.
Is there anything else you would add for that for people? Like if they're kind of moving in that direction of, kind of pre-diabetic or they are diabetic, what kind of things they could do as far as like continued self-talk or like healing themselves or working on that spleen and pancreas and that kind of self-love? Is there anything else you would add to that?
Yes, I love that you use the word add, because as far as managing chi and prana and life force goes, you're always thinking about how can I add to this situation. So you don't look at it like, I'm not going to eat sugar ever again. You say, I'm going to start eating fresh juice every morning and have oranges as a snack instead of, the Snickers bar or the candy or the processed food. So you replace whatever you're eating in order to add energy and add life force, because it will have a cumulative effect and you'll continue to advance yourself.
I love that, because I think a lot of us feel like we have to deprive ourselves of certain things. Then we kind of go into this place where I think even after a few days we kind of start, I know personally I go into that freak out, like I'm depriving myself and I don't feel good. So adding something in, and especially food, because I feel like that's such a big part of our like culture of like emotionally caring for ourselves and then being cozy or having family time together. So not that we're deprived, we can't have that pasta or we can't have that piece of cake, but we can have, like you said, a bowl of berries.
You can have beautiful spaghetti squash with olive oil and Parmesan cheese on it, you know, if you're not going to have pasta.
Yeah.
So you add wonderful things in that are healing for you, and you focus on how good they are for you and how good you're going to feel when you do them.
I love that. Thank you so much on that one.
You're welcome.